sit here. We're going to try and make this informal. It's late in the day, sequestration looms. I think we lost one of our panelists here who's a senior official with the WIC group, and I have a feeling it was worrying about, you know, sort of what's happening at the home office. So I know it's on a number of minds as we all sit here. So you're nice to stay. But I want to make sure that late on a Friday we conclude on a high note and a note of practical, can do and some optimism as well. So as Raphael said, what we want to do is try and distill some good ideas from this very rich discussion. You know, I was thinking that all of us here work in various organizational settings in the field of maternal and child health, I think broadly defined. And I'm guessing that from where each of you sit, you've all been asked by other groups to do things, to pay more attention to this topic, to include that issue in your own work and so forth. And that's really what our group is doing today, this Institute of Medicine group. We've assembled a number of people here and on the web who sit in somewhat different organizations, control different systems and departments and so forth. And we're hoping so much that you all will find ways to take these wonderful materials and ideas and more and build them into your own processes and priorities and work. We're asking you to disseminate things. We're asking you to put them in place, to implement them. We're asking you to coordinate with us and each other. But you know, the issue is, why would you pay attention to this request and not a whole bunch of other ones you might get? I remember years ago, actually through an Institute of Medicine effort, going to the American Academy of Pediatrics and asking them if they wouldn't please pay more attention to A, B, and C. And our group had figured out a whole bunch of things. And they said very nicely, well, we agree with those ideas, but you know, pediatricians are asked to do a million things all the time, and there's no payment for any of them. And so why would we do your issue, rather than all the other ones we're already responsible for? So the real question is not only what are our good ideas to bring this very important issue of gestational weight gain to the attention of people in positions of authority and in touch with real people. The real issue, I think, is in addition, is what can we do to get our colleagues to pay attention to this one, maybe with more intensity than they do to others. It's, in a way, it's a competitive marketplace. Why ours? Why this set of materials, pamphlets, posters, recommendations, rather than a lot of others? And I think it really means that we have to have good ideas. They have to be edgy, clever, deeply science-based, needless to say. But there has to make something about them kind of come to life in order for them to gain the attention of other people like you who are very busy in their organizations and fields. And I think that one of the things that makes, in some way, this a little bit even more complicated is that, as Dr. Phelan, did I pronounce her name, or is she still here? I thought that was an incredibly important presentation because it showed that even if we get someone's attention, we're not exactly sure what it is that we want these pregnant women to do or not do in order to reach the weight gain guidelines that we have outlined. We have some good ideas, but it's not nailed. We're not absolutely certain. I thought that was an important thing to face. Every report out of the National Academy of Sciences always says more research is needed, and I think we heard that too. But again, I hope that we will, first with my two colleagues to my left and then others in the room, think about what have we learned or what can we recommend that's an important idea for advancing the cause, which is getting this way of thinking, these new guidelines out into the broader population. So let me begin with Ann Santadonato, who's with the Obstetric and Neonatal Nurses Association, if I'm correct about that. Oh, you're Regina, I'm sorry, where is she? Oh, I thought, I was told that she was, I'm so apologetic. I was told, my mistake. Let me get my list here. Regina, I apologize again. She's the Associate Executive Director of Public Health Policy and Practice for the American Public Health Association, where I gather you oversee a lot of portfolio programs and activities ranging from continuing education to global health. And Dr. Davis Moss is a Master Certified Health Education Specialist and is a member of the Delta Omega Honorary Public Health Society. So in your setting, what I imagine is that you also are asked to do a lot of different things. People want you to advocate for this or that, or include this or that. So tell us a little bit about how you make decisions about which things to incorporate, or what advocacy groups to meet with and really take on their issues and care about what they're presenting.
Yes, well, for those of you who may not know, the American Public Health Association is one of the oldest and largest public health associations in the world, and we represent, we're an umbrella organization for public health professionals representing every sector of society. So we advocate for a broad array of issues ranging, addressing the health and safety needs of the public. So you're correct in that we do receive quite a few requests in terms of taking action, and we try to focus on issues that will allow us to have an immediate impact. I mean, every year we spend some time identifying what would be our legislative priorities for the year. They're usually based in our 3 overarching priorities, which are eliminating, achieving health equity, rebuilding the public health infrastructure, and increasing access. Most recently, we changed that to the right to health and health care. In terms of gestational weight gain, we haven't actually taken action on this particular issue, but we do advocate for a lot of issues that are related to this particular issue. To name a few, funding, addressing, trying to ensure that the programs that HRSA provides for in terms of education for healthcare providers, as well as for services, increasing services, healthcare services, anything from contraceptive coverage. So I'll stop at that point. But
what do you think makes a difference within APHA as to what types of issues really gain traction, where the executive board gets together and says, this is really important, we're going to put a lot of resources into it, we're going to feature it in a plenary session at the annual meeting, all those things. What can we do to get this set of issues and materials at that higher level? Do we have to be pretty, or do we have to be well-funded, or what makes the difference?
No, you don't have to. You just need to be passionate, and with which you already are. And we have 29 sections which represent the various public health disciplines, maternal and child health. There's 6 or 7 sections I think would be relevant to this particular issue. Everything from public health nursing to maternal and child health, food and nutrition, and our activities as well as our scientific sessions, all of those are crafted by our members. And so our policies, which we begin in terms of our advocacy activities, as well as they're an evidence-based record of what the organization's official stances are on a particular issue. So one of the things I would recommend is working with in our sections. A lot of you are already members of APHA and are presenting and participating in our sessions to pass policies. But I would say, honestly, the IOM recommendations are heavily quoted in our policies anyway, and we're often referring to you in terms of when we're commenting. So you do actually, your members in terms of on the committee, as well as those that have provided insight into your recommendations and your formal reports, are all very active in APHA.
Yeah.
And so just continuing to explore synergies in that way. When you released we examined the guidelines in 2009, we published an article in the Nation's Health, which is our newspaper. It has a readership of several 100,000, and we continue to try to, when possible, help with promoting efforts.
Did you hear anything today, any idea about things to do, either even with individual women all the way up to working with CMS and Medicaid financing? Did you hear anything where you thought, that's either an important idea or that's a new idea that might really advance us in ways I hadn't thought about? You don't have to make that up, and I don't mean to put you on the spot. I mean, I was completely undone by this thing of the sticker on the scales, Linda. What does it say? The solution's at your feet, or what was it? Yeah.
I mean, it seems
that's at a small level. I'm actually looking for something a little more profound.
It seems to me that it would be beneficial to continue the lay literature, distributing the lay literature. Perhaps you could, tactics such as trying to reach these audiences through social media is right on target. Those are some of the activities we're doing. We use a database which has about almost 300,000 subscribers, and half of those are just the general public. So there is an interest in public health issues outside of public health professionals. But I might consider some non-traditional approaches, such as perhaps including information about gestational weight gain in pregnancy tests, or when women purchase prenatal vitamins or are given a prescription for prenatal vitamins. In any way that you can, captivate capture this target audience, I think it's great.
What's interesting about both of those things that you suggested is direct to consumer. It's not about training professionals or the financing system or any of those sort of big things. It's about individual women, which I think it's really important. One of the themes I think today has been that there are a lot of ideas and a lot of recommendations. The challenge is, how do we help individual women take action on those? This whole topic of motivation and behavior change. I really think that's one of the toughest parts of this. But you're right. When we organized my group about 17 years ago, we said to people, we're a tiny little organization and we can't communicate with individuals. We can't go, I remember saying to people, we can't go door to door with pamphlets. Well, now we can go computer by computer, by smartphone, with anything we want. The capacity to go directly to individuals has just exploded, bypassing all these various gatekeepers that used to sort of structure who got what and what they were handed, what they would learn. So I think you're right. And I didn't realize APHA had that kind of a audience.
Yes, and I mean, I would just add that we know that pregnancy is a high time of self-initiated health-seeking behavior, and women are motivated to try to improve and maximize the health outcomes for their infants. So we should be trying to capitalize on that.
Yeah, it's a great idea. Let me introduce Patricia Fontaine, and I hope I've got the right name. That's right, you're not Douglas Greenway, right? No. Okay. She's a family physician whose decades of clinical practice, teaching, and research have focused on perinatal care and women's health. She's also a senior clinical research investigator at Health Partners Research Foundation and is an associate professor at the University of Minnesota in the Department of Family Medicine. So let me ask you the same thing. What have you heard today about getting these ideas and these guidelines and even the actual physical materials that have been produced into widespread use, and of course particularly in the family practice area, but not only? Has anything really caught your imagination or made you sit up and take notice?
I think there have been, many good ideas.
Yes.
And it sparks brilliance throughout the day. I want to say that representing family physicians, we are an extremely large group, and the issue of what we cover and how this one particular issue get our attention is very relevant. There are 103,000 members of the American Academy of Family Physicians, and all of them are residency trained to do prenatal care, deliveries in the hospital, and then take care of babies afterwards. Although only a minority go on to include that in their careers. But with so many family physicians out there, even this minority is sizable. 18% of rural family doctors are still providing maternity care. So that means 1 in 5, although, and lower than that in urban areas, of course. But I think it will be very important to get these ideas out to our membership. And one of the I tend to think in a big picture first, and one of the big picture ideas that really caught me today was the idea of how maternity care needs to move into the realm of patient-centered medical home. We have talked about being patient-centered. We have talked about characteristics of the patient-centered medical home, which could be called maybe the Trinity home doesn't sound exactly like where we want to be. But, you know, we've talked about teen care. We've talked about the fact that so many of the ways we need to get the education to women at the time of their clinical encounter, we don't have time for. But if you take the principle of teen care and you've got interdisciplinary people within your office who are skilled in doing this, you can have everybody practicing at the top of their license and bring more job satisfaction to the physician and use their time more effectively. The physician, person like the primary clinician, whose efforts can be really augmented by the social worker, the dietitian, just the nurse coordinator who goes through the education materials with the patient. So there are just a lot of factors. We talked about having the patient develop her own goals. If you just tell her how much she ought to gain, she may or may not remember it. If you ask her how much she thinks she ought to gain in pregnancy, or how much she thinks she ought to be exercising, or how much she's planning to, you learn so much more about her. And you are able to then do the kinds of incremental goals that we talk about with motivational interviews. So those are just a couple of the big picture ideas that really struck me today. I can talk a little bit about some of the concrete things.
Absolutely, please do.
For those of us within the Academy of Family Physicians who just love mom baby care, there is a program that is the Maternity Care and Patient Safety Program. And one of the products that's important outcome of that program is called Advanced Life Support Obstetrics. I don't know how many people here have heard of it, but it's an extremely, there you go, thank you. It was designed to help maternity care providers know how to deliver care in the most infrequent but highly emergent situations in the world. And because we had a fast track to that organization, which now is international, gives courses throughout the United States and indeed throughout the globe, we got into the lecture on labor and labor problems. We got risks that obesity brings, and we got the new guidelines into those slides, those package slides that will be shown in here now.
It's fantastic.
So we hope to continue more. We have recertification for family physicians, and there is a specific module on obstetric care that has been updated or is in the process of being updated. And Lisa Davis is going to be our contact person with that. So, those are ways of getting, it's not direct to consumer, but it alters the healthcare delivery system in ways that will make it possible to get to many, many, many women having babies.
I think that's wonderful. I remember from my years working with the ACOG that one of the ways that groups that were concerned about particular issues, what they would focus on very rapidly was making sure that the board exams was 1, 2, or 3 questions on that topic. Because if it's going to be on the boards, then people learned it. So one other strategy we haven't talked about much today would be a very, I mean, you obviously have already done that, and so that would apply to a variety of groups, is to work hard to get the boards to include, and CME requirements in a number of ways, but it's in sort of the testing and regulation and certification of professional groups, to work hard on getting these topics built in there are a variety of ways. Does that make sense? Yeah?
makes so much sense, and it's critically important. I think family physicians and any other primary care or treated care providers, when you put it in the context of preventing obesity, preventing chronic disease, preventing diabetes, then I think there's no doubt that you can get the attention, even when there are a lot of other competing priorities.
Right. We're going to open this up for some more discussion, and I'm going to ask some additional questions of my colleagues. But I would love to hear from you all what you thought some important ideas were that came up today. They don't have to be big ideas; they can even be little ideas. But I think this is a very sophisticated group and very diverse in perspective, and we'd like very much to hear about them. What struck you? Dr. Catalano.